large metropolitan regions like Cape Town, Johannesburg and Durban need more stringent lockdowns than rural areas, which have been relatively untouched by the virus. The Health Minister, Dr. Bhekisisa, seemed to raise this issue during a visit to the Western Cape this weekend. That province currently has over 5,000 infections of COVID-19. For more, I'm joined by the Bhekisisa Centre for Health Journalism's editor, Malan. Mia, good evening to you. Thanks for your time once again on the Pulse tonight. It would seem, if we look just at the numbers and presume if the numbers lead to lockdowns, we're going to see the big urban centres in South Africa locked down for a long time to come.
Well, we don't really know that. I know in the Western Cape that Premier Allen Wind over the weekend said he would rather concentrate on hotspots and decrease the lockdown levels sooner rather than later to get the economy going. But what we also heard was that the Health Minister said that he confirmed this weekend that we will certainly see different lockdown levels in different areas in the country depending on the transmission risk of the virus.
Do we know when all of this is going? Do we know, I mean, the Western Cape seems to have particular challenges. There's a huge argument about whether it's because it's testing more people or whether it literally has more cases. Do you have a view on that?
So scientists are really still figuring that out. I haven't heard a clear answer. What some experts say is that the Western Cape is 3 to 4 weeks ahead of the rest of the country with its outbreak. So they're in stage 5, which is the outbreak stage, while the rest of the country is still in stage 4, which is the community transmission stage. And that is why the Western Cape is testing in a more targeted way, that they focus on hotspots rather than just general community testing, because that's how you're supposed to test in an outbreak stage. And some politicians, like you've mentioned, are using that to say that because the province is focusing on hotspots, the positivity rate, so the percentage of positive tests is higher, because those areas will necessarily have a higher percentage of positive cases. But many scientists don't agree with that, and they say that doesn't necessarily explain the high infection rate. It's rather that the province is just ahead with its outbreak, and that COVID-19 is really not that unique in that regard, that other viral infections such as influenza also usually start in the Western Cape and then work their way up to the north.
Okay, I mean, there's so many different things to consider when it comes to restrictions and lockdown and whether there should be changes. What for you are the main factors? We know that the lockdowns were to push out the number of infections, to push out the peak. Is it time to have a conversation right now about loosening up some of these restrictions?
Well, I mean, we obviously hear in the media and everywhere that people are very, very concerned about the economy. So you have to find a balance between the science and the economy. There are some scientists that argue that further lockdown at this stage wouldn't be beneficial for us, that there's really nothing. I mean, everyone agrees that there's really nothing we can do to stop the spread of the virus. We just use the lockdown to buy time, and there's a little bit of disagreement on whether the lockdown was successful with, doing the right type of testing, but most people at least agree that it was useful when it comes to buying time to prepare health facilities.
It would obviously be, in a perfect world, we'll be looking at perfect data. We would know in real time where the infections were. The fact that we have imperfect data, we don't have all the facts, actually makes it very hard to plan.
It does, and the Western Cape is an example. So normally when you hear of test results, say of today, it really tells you what the situation was 2 weeks ago because of the 2-week incubation period of the virus. But now with backlogs in a province like the Western Cape, where you could wait up to 2 weeks for your test results, you have to add that period. So in some cases it will tell you what was happening a month ago. So we're very likely looking at a situation that is already far worse than what the test results tell us.
And then, of course, there is what the Western Cape can tell the rest of the country about what its pandemic will look like.
Well, we can look at the Western Cape because it is ahead of us 3 to 4 weeks with its outbreak, and we're likely to follow the same trend, just like we're looking at Europe and at other countries at what happened there that are way ahead of us. So it certainly can give us some clues, but many many scientists and government officials and, a range of experts sort of agree that the Western Cape is having quite a good strategy for the outbreak, that it's quite scientific, it's quite targeted. It is just that the outbreak is really ahead and there's nothing much that you can do to stop it.
We've also seen large numbers of people moving from the Western Cape to the Eastern Cape who actually have the virus. It suggests then that the testing just isn't up to scratch at this stage, and the Eastern Cape now is going to have to deal with those cases.
Well, the Eastern Cape, while the Western Cape, tests the highest proportion of people in the country, the Eastern Cape does not test many people, and it still has a high number of cases. If you look at it proportion-wise, I think it's like only 5th or 6th in the country, and what part of the proportion they test. So the Eastern Cape is certainly going to have to speed up its testing and really test more people.
Malan, thanks very much indeed. The Editor-in-Chief at the Bhekisisa Centre for Health Journalism.